Good morning, everyone. Today I am going to start with the first bone of the supex or the superior extremity, which is our upper limb. Mostly, if in the medical colleges they start with the superior extremity, so they would start with this very beautiful S shape, the beauty bone or the collarbone, which can be entirely palpated throughout the extent. You can see if we can palpate it from here to here. The first thing that needs to be discussed is always the anatomical position. And this is a long bone, but it has certain peculiarities which I will discuss later on as we go further with the bone. This is a long bone. This is the only long bone which is horizontally placed and is connecting the neck with the trunk. So this can be entirely palpated. This is subcutaneous in nature, not very deep, anything lying just under your skin, just under the fine fat layer. So that is called subcutaneous. Okay, so this is a subcutaneous bone and this is S shaped. The anatomical position, we have few points. Let's go one by one. We can see it is convex in the medial 2/3 and concave in the lateral 1/3 anteriorly. First point. The second point will be, this is, as you can see, if we zoom it in, this is quadrilateral in nature and this will face medially. This flattened antero-posteriorly, this side will be facing laterally. And as we go in the posterior part, the inferior part rather, we can see there is a groove here. You can see it's marked with red. So this groove should place inferiorly. So there will be 3 points. One is the medial lateral, one is anterior posterior, one is the inferior part. So this is the clavicle of the right side. And whenever it is the bone of that particular side, like this is a right-sided clavicle, so it should be held in the right-hand side. If it would have been the left-sided clavicle, it would have been placed in the left-hand side. For your interest, I'm just showing the position of the clavicle, placing it on my body. So here you have the clavicle like this, right? So now let us discuss, as I said, this is a long bone, but most of the long bone, as I have already said, that this is placed horizontally. Most of the long bones, they are placed vertically, like we have the femur, the humerus, these are the upper limb, lower limb, the classical long bone, which we have even heard in plus 11, 12. So, but this is the only bone which is horizontally placed. Some peculiarities, some interests, let's develop on this bone. Then we will go with the muscle attachment, if any ligament, then the ligament attachment. Then if any fracture, which will occur in this bone, what are the types of fracture occurring in this bone, and the ossification. So this is the way we read any particular bone. Even the examiners, they first ask the anatomical position. Then if there is any peculiarities of a particular bone, then that will be asked. The muscle attachment will be asked. The ligament attachment will be asked. Then the ossification, definitely very, very important. You must learn the ossification. And finally, they will try to explore if any clinical applications, because ultimately whenever we are learning any bone, it's not just about any, not for the anatomical position or not for the, the muscle attachments, but when we are, dealing with the patients, we should know the type of fracture the patient is suffering from, if anyone, trying to do that. So let's come to the peculiarities of the clavicle, the beauty bone.
Start.
So the peculiarities of the bone, I've already stated, this is horizontally placed, subcutaneous throughout the extent. Now, it is membranocartilaginous in origin. When you would read the general anatomy, you would read about membranous ossification, cartilaginous ossification, but it is cartilaginous, membranocartilaginous in nature, the ossification part. Being a long bone, it has two primary centers of ossification. That is a peculiarity again. It is pierced in throughout by the intermediate scapular nerve. That is another one. Very importantly, it is the first bone to start its ossification by the 5th or 6th week of the intrauterine life. Intrauterine as in when the womb is in uterus, intrauterine life. Even the term may be in utero, that means the same thing. And the last bone to complete its ossification, so by 25 years of age. So it's not still completely ossified. These are the peculiarities, 5-6 points, maybe theory question, maybe a viva question. So peculiarities of clavicle, if it's placed in the table, it is often asked, and it is also one of the easiest bone apart from the sternum, which we will discuss when we are discussing the bones of thorax, one of my favorite. So this is one of the easiest bones of the table. Okay, so this is the peculiarities. So we are done with the first part, anatomical position. The second part, peculiarities. Now let's slowly understand the muscle attachments. Not many, but let's go by it slowly. Okay, now as I have already stated, there is this. Let's first talk about the ends. We have this medial end. This is the lateral end. Lateral end, if we notice it very nicely, let's see the bone. It is flattened above downward. ठीक है, but supero-inferiorly. Above downward, but supero-inferiorly. This particular bone, this side will form this. We can see this one. This will form the acromioclavicular joint. Now, when we go to scapula, which will be the next bone, there would be a particular process, a bony prominence, which is known as the acromion process, and it makes acromioclavicular joint. Fine. So this is about your this lateral end. Now when we talk about the medial end, and it is entirely covered by the fibrous capsule. When the acromioclavicular joint is formed, then it is covered by the fibrous capsule. What is fibrous capsule? That you would read when you are reading any type of joint, whether it is an acromioclavicular joint, there would be elbow joint, there would be shoulder joint. So you would read it then. Here, this saddle-shaped thing, the medial end, it will articulate. Articulate means it will join. Okay, it will form a joint with the sternal notch of the manubrium sterni. What is manubrium sterni? When we talk about sternum, then there is a particular process called the manubrium process. So it will form the manubrium sterni. It will form a particular joint. Okay, there is this particular end, the medial end. Here also we have the fibrous capsule and the interclavicular ligament. There is a particular ligament. So these are the things which is present in the medial end. And we have this entire shaft which will have this. I've already said that medial two-third is convex. We have all studied about the convexity and concavity when we read ray optics in physics. We all know about the convex lens and the concave lens. The same thing, convex, or we can say it's rounded. We can see it's rounded, right? It's rounded, and this one you can see it's certainly, it's notched, it's inwards. So it's concave. So medial 2/3 and the lateral 1/3. And this particular lateral, this is the easier side, okay? Why? Because it's flattened above downwards, so it has only two surfaces. One is the superior surface and inferior surface. The inferior surface, the superior surface, the anterior border, and the posterior border, right? So this is about the shaft. We are coming to this medial 2/3. It's a little detailed, so I'll come to it now. That is about your features of the various sides you are, reading about the bone. So we are done again. We are done with the anatomical position, the peculiarities, and with the features of the sides and the processes. If you are unable to understand the anatomical position, then please go back, rewatch the side determination part, the anatomical position part, because if you are not able to hold it in this position, now how we hold the clavicle? We hold the clavicle slightly like this, because in our body it's placed like this only. Okay, so we hold it like this in front of the examiner, slightly tilted forward. Okay, so please understand the anatomical position first and then only move forward with attachments, because if you don't hold it in the perfect position, then we are not given the pass marks, and that's very important. Okay, so let's now move with the muscle and the ligamental attachments. Okay, now we can see the medial tooth head, it's more cylindrical in shape. See, it's oval, rounded, cylindrical in shape. We can easily bind our hand around it, cylindrical in shape. Okay, now it has a it's an anterior surface, the posterior surface, the superior surface, and the inferior surface, right? Let's go one by one. This part will give origin to the clavicular head of the pectoralis major. Just go and see where the pectoralis major is located. Go and look at the picture. Otherwise, it will be very, very difficult. The superior surface, this one, you can see the superior surface will give origin to the strap muscle. When you are reading head, neck, face, strap muscles, that is your sternocleidomastoid. Now, my professor said a very beautiful thing. Let me tell that again. This particular muscle justifies its name itself. It's a clavicular part of the sternocleidomastoid. Sternum, clavicle, and the mastoid process. The three heads of the sternocleidomastoid, right? So just go and read about this muscle. It's very interesting. Now you go with the posterior surface, which will give origin to the sternohyoid muscle, and it forms the boundary of the cervico-axillary canal. Now what is it? You would read it in the gross anatomy, the theory part itself, and it's related to the trunk of brachial plexus. Brachial plexus, it's a very detailed topic, various short notes come from here. Brachial plexus trunk is a part. There are 4 parts of brachial plexus, okay? And third part of the subclavian artery, that's again an artery of the upper limb. You would read it. Now let's come to this very interesting, the inferior surface. A lot of attachments. One very important thing, the teacher's favorite, name one ligament, because we all end up learning the subclavius muscle attachment, origin of course. Then we all end up remembering the nutrient foramen. This is also very important, nutrient foramen. Very little, you cannot see it here, nutrient foramen. This hollow oval depression which you can see, this is a very favorite question of the examiner, which is your costoclavicular ligament is attached in this oval depression. So that's all about the medial end, not much, but of course, just remember the shape. Often various examiners love the shape. What is the shape? If you're unable to say it, then he might be, a little off. So that is cylindrical in shape, and the attachments, and never ever miss out the ligaments before your exam. That's very, very important. Okay? Fine. Now let's come to this lateral 1/3. Not much insertion. Let me first tell about the muscle. Origin, deltoid from the anterior border and trapezius from the posterior border. Now, it's border, not surface, right? If you say surface, then you get a 0. No matter how correctly you say the muscle attachment. So it is anterior border and the posterior border. It is subcutaneous between deltoid and trapezius. Let me, it's not very clear in the inferior part. You can see it's slightly rough. There is, okay, and here you see this particular thing. This is a tubercle. Okay, this is where the origin of the deltoid muscle is taking place. Deltoid is again a very, here, the deltoid is located here. The shoulder contour, the beautiful shoulder contour that you have, the rounded contour, that is your deltoid muscle. Just have a look at the diagrams. It is very helpful. And here you would have the conoid tubercle and the trapezoid ridge in this inferior part. And that is all about your attachment, the muscle attachment, the ligamental attachment, the features of the entire part. I think this would do enough for your exam. So this is about the clavicle. Now very important, we go with the ossification part. There are 2 primary centers, as I've already stated. This is a peculiarity of a long bone. The 2 primary center begin its ossification at the 5th to 6th week of the intrauterine life and will complete it by the 4th to 5th day of the intrauterine life. This particular, this one, the sternal end will start its ossification, begin by 19 to 20 year of its life and will complete it by 25th year of its life. And the acromial end occasionally present, another center, which will begin its ossification by 20th year of life and will fuse immediately. Ossification is a must read for at least clavicle and a few bones I'll mention, like femur, and their ossification is often asked. That's one of the important questions in the Viva table, so please don't miss it out. And now I move on to the fractures of clavicle. That is also very important. Please have a look at it. Now the final part, we come to the fracture of the clavicle. It's the most commonly fractured bone. Clavicle fracture, any strong blow to your shoulder, okay, the shoulder area, or if you fall in your outstretched hand like this, okay, like this, as in if you are falling like this, outstretched hand. This is very, very strong blow to your shoulder area. What happens is, it's very interesting, the particular patient will come with like this. You will see the patient like this and immediately your diagnosis would be the clavicle fracture. What happens is, the sternocleidomastoid, like the strap muscle, it will hold it upwards and the lateral end will go downwards rather, because the trapezius muscle is unable to support the entire body weight. And why this? The most common area of fracture would be the medial 2/3 and the lateral 1/3 area of the fracture. Now why is it so? This is the weakest point. The two curvatures are meeting here. Weakest point, I say the weakest point, the two curvature meeting. That is a reason, and very important would be the transmission of the force from the scapula to the clavicle entirely is coming. So this is the three reasons. So this might be one of the very important, explain why, according to the new pattern of our examination, explain why is a very popular, and we don't know how to write it. Just point out, this is the site of meeting of the two curvatures, the weakest side, and the force transmission from the scapula to the clavicle. That would be enough for your 3 marks. And the fracture of clavicle is commonly asked question, and the first thing that a person will ask you would be, how do you understand, the clavicle is fractured? You will always say the sagging arm like this. Okay, this is a gesture. And you would say if you're falling in outstretched hand like this, sudden force and blow and the clavicle gets fractured. It's the weakest bone of our body, the beauty bone of our body. Okay. So that's all about clavicle. Please do read it and revise it. It's one of the easiest bone in the Viva table. Now this is the first bone of, if you're starting with the supex. If you're starting with the infex, then definitely one of the deadliest bone in our body, that's your hip bone. When I discuss the hip bone, I'll recently discuss it. It's an irregular type of bone, various processes, it looks dangerous. So because it's one of the easiest and because it's an introductory bone, I have spoken a little bit. I again beg my pardon for making the video too long. Just have some patience, you would get to understand a lot of things. And always, as I've already stated in my first introductory video, go and see the muscles. Fascinating. You can go to Netter's Atlas. Okay, it's very tough. Then please go and look at your BDC or your Vishram Singh, whichever book you follow. I don't recommend any book. But my preference, as I've already stated, is Vishram Singh's anatomy. You can go, and if you're more interested, some people are, so just go and have a look at the clinical anatomy part, because that's what will, keep you forward in the practice. And one thing I always state, that just don't rudely learn it. Just try to see the muscles. Just try to fascinate yourself. I know it's too hard to remember so many bones at the end. So just have a look at it. It's a fascinating bone. It's a beauty bone. We can palpate it in our body. Just feel it and have fun. So that's it for today. That's it for the clavicle, the beauty bone.